Hi, my name is Peter Gay Klink. I have a doctorate of pharmacy and I am certified in medication therapy management. I also have a pharmacogenomics certificate through ASHP, and my passion is pharmacogenomic uh, testing and counseling. I feel the other missing piece is nutrigenomic testing and counseling. I believe these two together can help resolve a lot of the problems that we're currently seeing in patient care. And as a consultant pharmacist, I decided to test my own genome and see how my genes affect different medications. Currently, I'm not on any medications, but I felt it was still important to get tested as this can help in my future care should I get hospitalized or should I need to be put on any medications. So I got tested through OneOme, and I'm going to be referring to my notes. I've had my results for several weeks now, and I have been considering what to say on here because this is a public forum and my medication record is private. So I will talk about a few of the surprises I had and how I feel that impacts my health and my knowledge about my genes. So the first thing, there are three different genes that we currently know of, and there's information for, uh, and also that were tested on this particular test because different pharmacogenomic testing companies select different genes that they interrogate whenever they are giving you results. So not every company will interrogate the same genes, and several of the genes are interrogated by all companies. And so I did OneOme because they're more appropriate for patients of African American descent. So OneOme, on their result that I got, the results I got from them, there are three of the genes that affect antidepressants that I found uh, are either they're either intermediate. I'm either an intermediate metabolizer. I have poor function, so I'm a poor metabolizer, or decrease expression, which also means that I will not be able to process antidepressants as well as someone who has normal metabolism for antidepressants. So I thought it was interesting, and I've been happy to say that I have never had issues with depression or mood stabilization. And so it was good to know that if I do develop issues like that, I can kind of figure out which drugs are probably going to be more appropriate for me. And I also realized that maybe depending on the drug, if it's a pro drug, meaning it needs to be converted to the active form, or if it's just a drug that's already active when taken, then I realized that maybe I'll have to have lower doses, or if it's a pro drug, maybe I won't be able to use it at all because it won't be effective for me. And so this was very interesting to find out. Another thing I found out is that there is one particular opioid that gets prescribed a lot, especially after patients have had surgery, that I would not be able to process very well. Um, However, I do have another gene that processes pretty much all the other opiates. And so I know which one I shouldn't try, and I know the others that would probably work for me. Another, I also found out that I am a poor metabolizer for a cancer drug, which is used principally for colon cancer. And that was good to know as well, so so that if I were prescribed that drug, I would know that it might not be the most effective for me. And then in my previous presentation on pharmacogenomic testing, where I said sometimes we can find secondary findings, I discovered a secondary finding. I found out that I am a homozygote, meaning I have this recessive gene, which is I got one from my mom and one from my dad. And so I'm homozygous for this recessive gene. And as a result, I don't break down bilirubin very well. And because of that, there are higher levels of bilirubin in my blood system than for other people. And that was interesting to know. And it's called Gilbert syndrome. And that's interesting to know because if I were ever tested, my blood was tested, and I had high levels of bilirubin, my doctor might be led to think that they need to check my liver, but my liver functions just fine. The enzyme that breaks down bilirubin in my liver is not very active. And so that was very good to know so that I don't do a lot of unnecessary testing. What this also means is this particular gene also does not break down a cancer medication very well either. So I'm aware of that, and now my doctor is too, because I shared these results with my doctor. Also, this, because it doesn't break down that particular cancer drug, I'm at an increased risk for developing neutropenia, which is low neutrophils, which is one of the cells that our immune system uses to help fight off infections. So that I'm at increased risk to have neutropenia, which is low levels of that cell, if I go on that drug. So to me, I felt like I learned a lot from my pharmacogenomic testing, and it can help guide my doctor in the future and myself as, as health problems develop later on in life. And so I just wanted to let everyone know that even if you're not on a lot of medications, or even if you feel you know a lot about your medications, it's still of great value to do pharmacogenomic testing, because you never know what you'll find, and it may be able to help guide therapy for you in an emergency situation, or even if you just are on medications that don't seem to be working. Hope you have a great day. And if you'd like to know more about your genes and how medications are processed due to your genomic makeup, call me at 801-792-2504. Have a great day. Thanks.